Hello everyone, my name is Kevin Msendek, and today we'll be looking on Autocoids part 2, and today we'll be discussing on serotonin as one of the autocoids. So serotonin is one of the autocoids which is formed uh, from tryptophan, which is converted to 5-hydroxyl tryptophan by tryptophan hydroxylase enzyme and carboxylase enzyme. And serotonin is highly concentrated in the central nervous system, GIT, and platelet. And serotonin binds to three types of receptors, which are serotonin 1 receptors, serotonin 2 receptors, and serotonin 3 receptors. Serotonin 1 receptors, they are mainly located in the central nervous system, in which when serotonin binds to these receptors, they cause behavior change and cerebral vasoconstriction. And the serotonin 2 receptors, they are located in the smooth muscles, where they cause spasm of the smooth muscles. I mean spasm of the intestine, bronchi, and uterus. And they are also located in the central nervous system, where they regulate mood, sleep, and appetite. They are also located in the blood vessels, where in the blood vessels, where they cause vasoconstriction and dilate skeletal and the coronary vessels. And they are also the serotonin 2 receptors. They are also located in the platelets, where they regulate platelet aggregation. Away from serotonin 2 receptors, let's talk about serotonin 3 receptors. Serotonin 3 receptors are located in the peripheral nervous system, where they are known to produce pain, and via the excitation of sensory nerve endings nociceptors, which bring the formation of inflammatory mediators such as bradykinin. So since we have talked about the receptors, let's talk about the drugs that we can use to block these three types of receptors, and to mimic these receptors. So I'll start with the serotonin 1 agonists. So serotonin 1 agonists, I'll just give two examples, which are sumatriptan, which causes cerebral vasoconstriction, and buspirone, which has the anxiolytic effects. So these are examples of serotonin 1 agonists. So let's talk about serotonin 2 agonists. Serotonin 2 blockers. So serotonin 2 blockers, I will give two as well, which is, and the first one is methylsagide. So methylsagide is one of the serotonin 2 blockers, and it is used in the prophylaxis of migraine and treatment of carcinoid tumor. The other drug that I'll talk about is ketanserin. Ketanserin blocks the serotonin 2 receptors and alpha adrenoreceptors and therefore it is used in the treatment of hypertension. Away from away from the serotonin 2 blockers or antagonists, let's talk about serotonin 2 receptor blockers. Serotonin 3 receptor blockers. Serotonin 3 receptor blockers, I'll just give one example, which has antiemetic effects, which is ondansetron. Ondansetron is an example of serotonin 3 receptor blockers, which are serotonin 3 receptor blockers, and it's used in the treatment of severe vomiting caused by cytotoxic drugs. Thank you very much. My name is Kevin Msendeka. I just wanted to share with you on the autocoids. Next time we'll be looking on migraine and anti-migraine drugs. May God bless you.